Good news, guys. The most recent immigration news will not affect your chances of getting your desired job in any way. I know you guys are worried about if the fact that the UK is still in shortage of workers is still valid just because of the most recent immigration news. I do not know if I should call it a rumor, but let's dissect it first so that you can understand it fully. There will be no point of going into the main topic of this video if you do not even know that you can get the jobs. So we cannot skip it and pretend that there are no doubts or worries. Suella Braverman said, "What we've got is too many low-skilled workers coming into the country. We have also got a high number of students coming into this country. And we have got a high number of dependents." She also said, reducing migration was an aim shared by all of Truss's senior ministers. Because of this, statistics came up. In fact, Nigerian newspapers said migrants from UK into Nigeria carry along the most relatives to the UK. Due to all this, people were scared about if their UK hopes are still alive. But according to reports, the UK government or Prime Minister have not mentioned anything about immigration. All this was said by the Home Secretary, Suella Braverman, not the government, not the Prime Minister. Now, you might be wondering, who is Suella Braverman? Suella Braverman is the recently resigned Home Secretary of the United Kingdom. The Home Secretary leads the Home Office and is responsible for national security, policing, and migration policies of the United Kingdom, for those that do not know. So now, let's talk about why you should not be worried. This is BBC and it was published on the 19th of October 2022, and it says, the UK Home Secretary just resigned. The link to this article is in the description, so you can read it later. So back to the story. She's the one that made all those statements that we have been hearing. How Britain has too many low-skilled migrant workers and very high number of international students who often build dependence with them. She was the one that made the statement, not the government, not the Prime Minister. Reports have shown that she was against the immigration, now has resigned. But wait, do not celebrate yet till you get an understanding of the full story. Why did she resign? So it was stated that she sent an official letter to a parliamentary colleague using her email. Here is the resignation letter in full. She sent an official letter through a private email, which is not supposed to be done. In fact, it's against the government's policy. She did that and it was discovered, so she had no choice but to resign. Also, it was discovered that there were all documents on immigration, so more was probably going to be said. You can also check the description to know the full story. Now, here is why you should be happy. Before she resigned, even the UK universities and the universities UK International were all unhappy with her statements and even calling for her to retract her comments on international students, to reaffirm the centrality of the international students and their dependents to their plans for the economic future of the UK. 2. On 17th October 2022, the UK government ministers were warned that any U-turn in their commitment to grow international student numbers would result in billions of pounds in lost revenue, wreck their growth plans, and damage local economies in their constituencies. 3. Regarding work, the Department of Health and Social Care has launched a task force to bring in more staff from overseas into both social care and health. In time for what is said would be a challenging winter. The number of vacancies in adult social care rose by 52% between 2021 and 2022. So you can see there is a need for migrants for work, study, and other aspects. So do not lose focus because of half stories or rumors. So now, let me tell you guys the secret. According to data of the General Medical Council of the UK, the total number of Nigeria-trained doctors who migrated to the UK as of August 30th, 2022 stood at 10,096 according to Punch newspapers. Many people have and are still taking advantage of this opportunity. So don't let enemies of progress distract you. And now, you guys know why the immigration rumor is not your business and why you should not shift your focus. Most of them are recruiting from overseas. Some of them are just looking for those in the UK who require visa sponsorship. So we will go through it together and I will show you guys so that you can check them out and see the one that suits you and then apply. And as we did in the last video, I would also enlighten you on some rules for those that might not know much about them or know that they are qualified or close to being qualified for them. Everyone should be carried along as planned, and I want you guys to learn so much that you will not need any additional research after watching this video. My name is Caleb from Visa Point, and you are welcome to our channel. Please like this video and share with everyone so that they can benefit from it as well. And to all our returning subscribers, you all are welcome back, and we are happy about the feedback that helped us to make some changes that you are seeing in this video. And if you are yet to subscribe to our channel, what are you waiting for at this point? Please hit the subscribe button. Thank you, and I'm sure you have a nice time here. So our first rule here is clinic nurse. But before I start, just for those that are just watching our video for the first time, you go to findajob.dwp.gov.uk. After that, you search visa sponsorship and change the location to UK. After that, you would find all the jobs that came out in the search results available for visa sponsorship. But keep in mind, always remember, it's not all the jobs that are there that are available, so you still have to read through, and that is one of the benefits of joining our videos, so that you would not waste your time applying for the one that is not available. So in the end of this video, I would also show you guys how to find the ones that are available, so make sure you watch this video till the end. So now we can continue. So as I said, the first rule here is clinic nurse. Firstly, who is a clinic nurse?
They are the first set of people patients frequently see when they arrive at the medical clinic for treatment. They are responsible for giving care in a medical clinic setting. They must possess great communication skills to effectively serve as a liaison between medical professionals, service providers, and patients. They can pursue careers as a registered nurses, licensed practical nurses, or nurse practitioners. What is nursing at a hospital? It is giving patients immediate treatment in a hospital setting. It is known as hospital nursing. Compared to smaller medical practices, hospitals frequently pay greater salaries and provide more prospects for growth and overtime. Hospital nurses benefit from great employment security since hospitals are always looking for new talent. Studying hospital nursing also enables the investigation of a variety of medical specialties. Comparing clinic nurses to hospital nurses. Although both hospital nurses and clinic nurses operate in a healthcare context, there are also major differences between the two jobs. Making the two distinct might help you choose which area of nursing to specialize in. The differences between these two varieties of nursing are as follows. As a clinic nurse, your duties are working closely with patients, doctors, and other medical professionals. Collecting patient information, including symptoms, medical history, and insurance information. Making patient nurse assessments of the patient's medical condition. Assisting during patient evaluation. Providing medical advice to patients. Administering medications if necessary. Monitoring medical equipment to ensure its proper operation. Cleaning and sanitizing patient rooms. Helping move or lift patients and heavy equipment. While as hospital nurses, duties are talking to the patient about the reason for their visit and their symptoms. Taking the patient's vital signs. Performing physical examinations, also called nursing health assessments. Drawing blood and collecting other samples for diagnostic tests. Administering wound dressing changes. Administering medicine and educate patients on how to take medication correctly at home. Offering emotional support to the patients and their families. Communicating regularly with other healthcare workers, including the sharing of vital patient information at shift change. Maintaining accurate patient files. Preparing the room for patient treatment. Cleaning and sanitizing hospital rooms after patient treatment.
Now, I believe that we all have an understanding of who a clinic nurse is, so we can go into the job description together. So we have posting date 18th of October 2022, salary £27,000 to £32,500 per year. Additional salary was not stated. Hours full-time, closing date 17th of November, so you still have some time. And here is the location, the job type, the job reference, summary. You can read through the summary to see if it suits you. They are looking for a registered nurse for a specialist clinic. Their client is one of the world's largest independent renal care providers, devoting their efforts to developing the best renal care services in the field of dialysis. A small treatment center in West Midlands. The role: you provide high quality nursing care to patients undergoing dialysis and promote good working relationships with the NHS. Your key duties include initiation and termination of dialysis treatment, preparation and monitoring of dialysis machines and systems, physical assessment of patients pre and post dialysis, performing analysis of patients' assessments, laboratory data, provide ongoing patient education. Comprehensive professional training program will also be provided. You'll be required to work shifts Monday to Saturday between the hours of 6:45 a.m. to 11 p.m. No nights, Sundays or Christmas or New Year, so you know you're going to enjoy your holidays. Those are the things they require of you. You must be NMC registered nurse. You must have at least 1 year experience in general nursing. You must have an awareness and understanding of NMC Code of Professional Conduct. You must be able to work autonomously and within a multidisciplinary team. You must have excellent communication skills with fluency in English. So you can see we already talked about the salary. So this is the link in which you can apply. So you can start your registration after watching this video. So the second one here is clinic nurse, and there are just a few differences, so we can go through it together. The posting date is same with the first. Salary is between £26,500 to £32,500 per year, so it shows that it's a bit less than the previous. Additional salary could be more because the previous was not stated, and this is £3,000 welcome bonus. Your hours full-time, closing date same day, 17th of November, so have this in mind if you were interested in the first. Location is given, job type, permanent, job reference is also included. Summary: registered nurse, you can read about it. The salary was stated again. They are recruiting a full-time clinic nurse for private dialysis clinic located in Havant. This is a new service for dialysis treatment for patients between Havant and Salisbury. You can read about it. The key duties are very similar with the first, if not the same, and your requirements are a bit different. You must have RGN with NMC registration, at least 1 year experience in general nursing. You must be able to work both autonomously and within a multidisciplinary team, and it is full position of 37.5 hours per week with a mixed shift pattern from Monday to Saturday. Their client is offering salary starting from £27,000 to £32,500 plus the welcome bonus, which is £3,000. So you can go through it and see if you are interested in it. Third one here is registered nurse, and from the video you watched about who a clinic nurse is, you would already understand who a registered nurse is because they are highly related, and if you are qualified as a clinic nurse, you can also work as a registered nurse. So we can go into the job description together. Posting date 18th of October 2022, salary £37,000 to £32,500 per year, hours part-time, closing date same day, 17th of November. So I think you should apply for the 3 in case you're able to get anyone. Location is given, job type also permanent, and the summary is here. Registered nurse for small dialysis treatment center located in Stockton in Durham. So They can accept nurses with an interest in renal dialysis nursing, as thorough training will be provided, so you don't need to worry if there are some few things you don't understand. So you can go through the other part of the summary, and your role is that you provide high quality nursing care to patients undergoing dialysis and promote good working relationships with NHS. Your key duties are quite similar to that of the client nurse: initiation and termination of dialysis treatment, preparation and monitoring of dialysis machines and systems, physical assessment of patients pre and post dialysis, performing analysis of patients' assessments, laboratory data, provide ongoing patient education. Comprehensive professional training program will be provided. As I said earlier, your work time is between Monday to Saturday, hours 6:45 a.m. to 11 p.m. Candidates must be NMC registered. You must have at least 1 year experience in general nursing, awareness and understanding of NMC Code of Professional Conduct. You must be able to work autonomously with and within multidisciplinary team. You must have excellent communication skills and fluency in English. Your salary is quite similar, so you can see the first three were grouped together for a reason. Salary is quite similar, so you can go on with your registration after watching this video. Here is Salaried GP. But firstly, who is a GP? General practitioner.
A general practitioner is a doctor based in the community who treats patients with minor or chronic illnesses and refers those with serious conditions to a hospital. General practitioners and family physicians diagnose and treat the diseases, physiological disorders, and injuries of patients. They provide primary contact and continuous care toward the management of patients' health. They usually work in private practice, including group or team practices, hospitals, and clinics. Residents in training to be general practitioners or family physicians are included in this unit group. What are the duties of general practitioners? This group performs some or all of the following duties: examine patients and take their histories, order laboratory tests, X-rays, and other diagnostic procedures, and consult with other medical practitioners to evaluate patients' physical and mental health. Prescribe and administer medications and treatments. Perform and assist in routine surgery. Provide emergency care. Provide acute care management. Vaccinate patients to prevent and treat diseases. Deliver babies and provide prenatal and postnatal care. Advise patients and their families on health care, including health promotion, disease, illness, and accident prevention. Provide counseling and support to patients and their families on a wide range of health and lifestyle issues. Perform patient advocacy role. Coordinate or manage primary patient care. Provide continuous care to patients. Supervise home care services. Report births, deaths, and contagious and other diseases to governmental authorities.
So now I'm sure you understand who a general practitioner is. So let's go into the job details together. So salary was not specified, but additional salary is £127,723 a year, and the salary was not specified, but this is still the amount that general practitioners earn generally a year. It's a high paying care job, hours full time, closing date 6 November 2022, job type permanent, and you can see the summary. Recruiting salary GPs to work across Cumbria, and are pleased to offer tier 2 visa sponsorship for eligible candidates. So you can read more about the job, and don't forget the link to the jobs that we talk about are in the description. So after watching this video, all you have to do is copy it to your browser and go ahead with your application.